Okay, so let's get right into it. Have you ever looked at a spot on your skin and had that little nagging thought, should I be worried about that? Well, today, we're going to pull back the curtain and show you exactly how doctors figure that out based on the official guidelines they follow. And first, let's talk about why this is so important. Skin cancer is actually the most common type of cancer out there. And in places like the Netherlands, the numbers are just climbing. We're talking 1 in 5 people in their lifetime. That number you're seeing, that's not just a statistic. It's a massive public health issue, and it's why knowing these warning signs is really for everyone. All right, to get our heads around this, we're going to break it down into 5 parts. We'll touch on why this is a growing concern, then we'll get into the 3 main buckets every spot falls into. After that, we'll cover the detective work your doctor does, a super simple tool you can use at home, and finally, the really important role you play in all of this. So first up, let's just get a sense of the scale of this problem. You know, it's not just that skin cancer is more common. It's also about awareness, which is a good thing. People are hearing the message, they're more worried about the risks, and so they're going to see their doctors way more often about suspicious spots. I mean, a 50% jump in just 10 years, that's huge. And it's put skin health right at the top of the list for GPs. So when you walk into your doctor's office with a spot you're worried about, their brain immediately starts sorting it. It's got to go into one of 3 main buckets. Think of it as the first big step in solving the mystery. The first, and thank goodness, the most common category is benign. This is the news you want to hear. It means the spot, like a regular old mole, is totally harmless. It is not cancer, and it's not going to turn into cancer. Total sigh of relief. Now, the next bucket is premalignant. And this one is really important. A spot like this isn't cancer yet, but it's showing some weird changes. It's basically got the potential to become cancer down the road, if you just ignore it. This is exactly where catching it early can stop a much bigger problem from ever happening. And that brings us to the third category, malignant. This is the one where, the lesion is cancerous. And there are 3 main types you've probably heard of: basal cell carcinoma, squamous cell carcinoma, and the one that gets the most attention, melanoma. But here's something that's absolutely crucial to understand. Not all skin cancers are the same. Not even close. Look at this breakdown. Basal cell carcinoma, it's the most common by far, but it almost never spreads. It's a local problem. Squamous cell has a pretty low risk of spreading, but it's not zero. And then there's melanoma. It's less common, sure, but it's the most dangerous because it has a much higher chance of spreading if you don't catch it really early. Okay, so knowing those 3 categories, how does a doctor actually decide which bucket a spot belongs in? Well, it's definitely not a guess. It's more like a methodical, step-by-step investigation. And this quote right here, from the actual medical guidelines, says it all. There's a plan, and it all starts with 2 really simple things. What's the color of the spot, and what's the texture of its surface? Just those 2 clues immediately help the doctor narrow down the list of possibilities. The detective work always starts with questions. Your story provides the first set of major clues. I mean, think about it. A spot that's changed recently, that's way more concerning than one that's looked the same for 10 years. Your personal history with the sun is a huge factor, and if melanoma runs in your family, that immediately raises a red flag. And while doctors look at a lot of things, some factors just carry more weight. You can kind of see the priority list here. Right at the very top, with the highest impact, is your lifetime history of sun exposure. That is, without a doubt, the single biggest piece of the puzzle. So after the questions, it's time for the physical exam, and it happens in these 4 basic steps. First, they do that initial check of color and texture. Then they take what they see and compare it to their mental catalog of what good spots and bad spots look like. After that, they pull all the evidence together, your story, the visual clues, to come up with a diagnosis. And finally, and this is so important, they check your entire skin because, let's be real, sun damage is almost never just in one little spot. Now, inside that whole process, there is a super famous tool that doctors use to look at pigmented moles, and it's specifically for spotting the warning signs of melanoma. You've probably heard of this one. It's the ABCDE rule. It's just a brilliant little memory aid that's just as useful for you at home as it is for your doctor in the clinic. It takes a really complex visual check and boils it down to 5 simple things to remember. So here's what it all stands for. A is for asymmetry. A normal mole is usually a nice, even circle. If you fold it in half, the 2 sides match. B is for border. You want to see a nice, smooth, clean edge, not something that's jagged or blurry. C is for color. One uniform color is good. Multiple shades of brown, black, or even pink and red in one spot, that's a warning sign. D is for diameter. Generally, anything bigger than a pencil eraser gets a closer look. And then there's E, which might be the most important one of all, evolving. Any change in size, shape, color, anything is your cue to get it checked out. And on top of the ABCDEs, there's one more really simple idea, the ugly duckling sign. It's so intuitive. If you have a bunch of moles that all kind of look like they belong to the same family, and then there's one that just stands out. It's darker, it's bigger, it just looks different from all its brothers and sisters. That's your ugly duckling, and that's the one that needs attention. See, once you understand how your doctor is thinking and what they're looking for, the whole game changes. You become an active player, not just a spectator. And that knowledge, well, it's your best protection. Because here's the bottom line. The whole point of this entire system, the questions, the exams, the ABCDs, is to catch things early. For every single type of skin cancer, but especially melanoma, finding it and treating it before it has a chance to dig deep or spread is absolutely everything. So what's your take-home message here? What can you actually do? It really boils down to this. First, prevention. Limit that sun exposure. Wear your sunscreen. But your other superpower is detection. Check your own skin every few months. And don't forget the weird spots, like the soles of your feet or between your toes. If you see something new or something changing, now you know that's the signal to make the call. So, by understanding the method behind all this, you're not just a patient anymore. You're an informed partner in your own health. And that partnership between you and your doctor is the most powerful tool we have against this. So take a look at the question here. Knowing what you know now, what's one thing you're going to pay more attention to?